So even as Kenyans struggle with increased cost of living in the wake of the 16% fuel tax, a majority of residents in Nyeri are skeptical about ever receiving quality health care, a constitutional right. Many Kenyans still do not have access to quality health care. The county of Nyeri is among the pilot counties in the universal health care program. And KTN's Raquel Muigai reports on the frustrations of Wanjiko.
We all have an important role to play in the change that we want to see in our society. That is why the Standard Group, together with our partners, brings you Transform Kenya, the platform to help raise your voice and be heard.
Kenyan public health facilities have for a long time been considered an infamous preserve of those that cannot afford the expenses that come along with seeking treatment at private facilities. The Nyeri County Referral Hospital is one among many of those public health facilities.
Isipoangaliwa mzuri, watu wataumia sana sababu inaonekana kama watu huwa watakuwa wakikufia tu kwa kiti.
When we met with Joseph Ndongo at the Nyeri PGH, he had spent 6 hours waiting to be attended to. Until that point, he had only had his blood pressure tested. Joseph at the time was struggling to remain still, following a major back pain that made it difficult for him to walk or sit.
Wanakuja, wanajifungia kwa nyumba, sasa wagonjwa wanakaa tu nje wakiteseka.
His is, however, not a unique case, as this man, who refused to speak to us for fear of being victimized, was forced to look for drugs he required in a chemist, as the facility had no drugs for him. A scenario many others identify with.
Hospitali kikosa, mimi natumwa kwa chemist. Sasa nashidwa, mtu binafsi, inawezekanaje mtu binafsi ako na nguvu kushida serikali.
Efforts to have the county health executive member Rachel Kamau respond proved futile, with the county health director declining an interview despite the trouble patients continue to undergo while at the facility. The health sector is faced with a myriad of challenges that the Nyeri governor cites inadequate funding as the source.
Out of the 2.55 billion, we have only 210 going to development, and the rest is going to paying personal emoluments and recurrent budget.
Nyeri County has at least 123 health facilities with at least 1,700 employees in the health sector. But lack of drugs and enough medical equipment has driven many to the referral hospital where more trouble lies.
53 doctors are currently in school. National government must also look at the possibility of taking over.
Nyeri County being one of the 4 pilot counties in the Universal Healthcare Program, many await to see if attainment of UHC in the county will remain a pipe dream or a reality. Raquel Muigai, KTN News.
On the 6th of September 2018, we'll be live on KTN News from the Strathmore Business School from 6 to 10 p.m. as we discuss healthcare. Be a part of the conversation on our social media platforms and help build a healthier, stronger and vibrant nation. Transform Kenya. Empower our nation.